Hello, I'm Dr. Nibu Varghese and I practice in Milton, Ontario. In this presentation, I wanted to lay to rest a question that we all have in our mind. Is orofacial pain, chronic orofacial pain, for real or is it a myth? The answer is it is real. I do get patients with this sort of condition, and the good news is we can successfully treat them because there is enough evidence-based treatment for these conditions. I want to share some of my patients that I have treated and I am treating with these conditions. I wanted to put up a disclaimer because I don't want to uh, advise on treating your own patients, or I don't want anybody taking this presentation as an advice and getting themselves treated. So this is just an information video for you. Do we have patients with this pain again? Yes, we do have. I get patients referred to my office, or dentists refer these patients to my office for treatment. Can we treat them? Yes, we can. We have evidence-based treatment modalities available for these patients and we are successfully treating them. But the important thing to remember here is to get a proper diagnosis. We have to be aware of all the conditions that are existing to get a proper diagnosis for these patients. Once we diagnose them, then we know the way to go to treat these patients. Here's my first patient. Now, the patient name has been changed for privacy reasons, and this is not their real names. First patient is Audrey, 52 years of age. She was referred to me by a dentist with a constant dull pain in the maxillary or upper left first premolar. She had an underfilled root canal on the tooth, which a root canal specialist, an endodontist, redid that and also did a surgery on the tooth to correct the situation. Even after a month, the patient was continuing to have pain and she was getting increasingly stressed out because there was no biological and tangible reasons for the pain. She was referred to me and I diagnosed her after my examination and history with an initial stage of post-traumatic trigeminal neuropathy. There was no central sensitization, luckily, so I treated her mildly with pregabalin 10 mg for 2 weeks and a neurosensory stent loaded with lidocaine. Some of the words that I might use here is a little too high at this level, but I will definitely put out more videos explaining these conditions at a later stage. So this patient was resolved of her condition and in the follow-up visits was happy and she did not complain of any pain. She is now being followed up by her dentist at his practice. The next patient is Mr. Khan, who came to me from a far distance, and he was treated at various institutions and dentists and general physicians and specialist physicians for a pain on the right side of the jaw for the past 8 years. The pain never subsided and he was increasingly getting stressed and depressed about this. I examined him and diagnosed him with myofascial pain, and bilateral capsulitis of the temporomandibular joint. I gave him an appliance and Flexeril, which is a muscle relaxant, and advised him with hot fermentation and avoidance therapy. His pain subsided in 2 weeks' time. Follow up after a month. He was perfectly normal, no more depressed. And then I referred him back to his regular dentist to get a night guard done to sustain the treatment that we have obtained. Mrs. Singh, again a case of PTTN, was a stressed patient. She's the only breadwinner of the family with an overcaring husband who is always at home with some disability pension. Patient developed pain bilaterally on the first molar, upper first molar, and did not want to get it root canal treated, so she got those two teeth extracted. Pain did not subside, and she was more stressed with this condition, and even more stressed with the fact that she got two of her teeth out for no good reason. And I diagnosed her with post-traumatic trigeminal neuropathy with a central component, and I advised her physician to put her on amitriptyline, and I gave her a neurosensory stent. Subsided her pain quite a lot, but she is a ticking time bomb, might flare up any time if there is any stress. Such conditions, Botox might help. There's not enough solid evidence for this, but investigations are going on. Next patient is Mrs. Jane, 52 years of age, had some trauma in her upper jaw due to fracture, and also a surgery was done to correct her bite. And she was diagnosed with trigeminal neuralgia some years ago, and she was put on tricyclic antidepressants, carbamazepine, gabapentin, all of them with some side effects to them. So when she found a little relief from her pain, she weaned herself off these medications. Now she started getting this pain again, and she wanted to know which of these drugs that she should go on. So I checked her mouth, and she was wearing an old upper denture, and she also had some erythematous tissues, which indicates that she was having oral candidiasis. So I treated her for oral candidiasis and gave her a new denture, which resolved her condition. But I told her that her oral tissues are sensitized, and anything that happens to her mouth would flare her up. So, a very distinct case of occlusal dysesthesia, a difficult condition to manage because it's got a psychological component to it. This is about a mother of 30s with a newborn who wanted to feel good. So she went to a dentist and got all her restorations replaced, silver restorations, amalgam fillings replaced with a composite in a single visit. So from that time onwards, her bite didn't feel good. She felt her jaw was thrown off balance, and she could not bite properly, and she was getting stressed with this. Eventually, it engulfed her socially and also in her family life too. She was constantly going to dentist, and I'm one of the dentists whom she visited with this condition. I knew what she was suffering from the first, and I had to tell her there's nothing much wrong with her bite, but we can address it in a better organized manner. She went out, visited a few prosthodontists in Toronto and in South Korea, and eventually came back to me. And then I did a Facebook transfer, articulated her models, and I showed her her bite. And then one of the tooth had no enough contact. I refilled it, stabilized her bite, and I also told her that She needs to get her teeth straightened out for better occlusion. Maybe that'll help her. And I did an intraoral scanning of her teeth to show her some of the excessive bites that she's having. So she understood, and eventually her fears calmed down, and she was okay, and she's not come back with any problem. It's been a year since. That brings me to the end of my presentation. I hope you enjoyed it, and I hope it gave you some knowledge. Thank you very much. Have a wonderful day.